Hi, good evening. Steve Adler. Got a minute? Uh, just by way of mention, I don't know if you saw the gentleman who I think is probably the soon to be leaving U.S. Attorney for the Western District held a press conference today talking about homicide in Austin. And that's a discussion that comes up a lot, and people ask me what the real numbers are. The truth is that homicides are up in Austin by 16 homicides compared to last year. And that's a lot because we take every instance of crime and every crime victim real seriously. But because our homicide numbers are so low, that 16 turns into a high percentage. So to put that in perspective, that 16, there were 31 people who died of homicides in Houston in the 2-week period ending December 4th. That's almost twice the number just in that 2-week period of time. Austin is one of the safest cities in the country. Our homicide rate is the lowest or second lowest of big cities. We are concerned about increases, and we need to be. And certainly if the U.S. Attorney is going to help us get guns off the street, like he said, that's something that'll be welcome because we'll take that support. We'll take support and help with violent criminals. But just remember, as you're thinking about our city, that we're the safest big city in Texas. We always want to be safer, and that's one of the highest priorities that we have. Also point out that most of the increases, such as they are, happened well before the city council took action on policing. Sometimes you lose track of those numbers. The other number that we lose track of is that while there's 16 more homicides this year, the number of people that have died of the virus, over 500 this year. We're really close. We're equal now. We're tied for third as the leading cause of death in the city when you're looking at the last full year numbers we have, which I think were 2018. That is a huge public safety risk, the virus, certainly in terms of the people who are dying in our city, over 500. And if the federal government wanted to help us with housing people or help us support our businesses during this pandemic, especially restaurants and other hospitality industries, that would be really, really valuable help to get from the federal government. And I hope that it comes. But while we're talking about COVID and COVID deaths as our number one public safety crisis right now, let's look at the numbers. Let's look at the first dashboard, and you can see that the 7-day moving average today stays at 50. That's where it was yesterday. We didn't do Got a Minute last night. We haven't been doing it on Thursdays for a while now because Thursdays has been when we have council meetings or every other Thursday. So we haven't been getting together on Thursday, but last night we went over 50. But the number that we had of new admissions yesterday was 68, which was the highest number we'd seen for a long time. That's what got us up to 50. Today, the number's down at 53. But it's still, we're meeting that benchmark of 50. So we continue to meet Dr. Escott, Director Hayden, County Judge Brown, and myself to talk about whether we should be moving into red risk level stage 5 and changing behaviors. We'll talk about that here in just a second because that's something that's being taken a look at. The number of cases we have today, you look at the right-hand side, is 415. Yesterday, the number was 545. One of the highest we've had in a long time, well above the 7-day running average. The 415 we have today is about the 7-day running average. Look at the color-coded chart that's in the middle. You can see the peak we had during the summer. Look how rapidly we went from yellow to red this summer. We just screamed through orange. This time, it's more gradual, and it seems to be maybe slowing at 50. We don't know. But we have to be really careful when we look at this. We have to be ready because if it makes a move north of where we are right now, then we're all going to have to work a little bit harder in order to keep our ICUs from being overwhelmed. The green numbers in the center are the 7-day moving averages for hospitalizations, ICUs, and ventilators. Let's look and see how the numbers are tonight as compared to those 7-day moving averages in each of those three categories. The number of people that are in our hospital tonight, 332. That's significantly more than the 7-day running average of 306. Number of people in our ICUs, 92 tonight, but the 7-day moving average is 91, so we're almost on top of that. I'm concerned about the ventilator number, which is 54, which is about 10% higher than the 7-day moving average of 49. That number of 54 is an increase of 7 over the 47 we had on ventilators last night. So again, we look at these numbers and we continue to move up, not at the same rate we did before, but we're looking at numbers in Houston and in Dallas-Fort Worth, in San Antonio, and the number of hospital beds that are taken up by COVID patients in some of those cities beginning to get real worrisome. DFW, it's like 17%. It's between 10 and 15% in Harris County and in San Antonio. Here in Austin, it's about 8%. As we see those other cities, if they continue to move up, one, it's a concern for them. Second, it's a concern for us because it means that a lot of the staffing help that we might want is going to have to go to those other cities. The good thing is that our city, when compared to the others, is showing a little bit more discipline, wearing our masks a little bit more religiously, perhaps, than other cities are. Number of people that have passed away today, 516. Again, that equals the third leading cause of death, accidental death, in the last full year that we had. That's 4 people higher than the 512 that we had yesterday. So still a very deadly disease. And it's just so hard because we are so close to having the vaccine. If we can just keep everybody safe through this holiday season that's coming up, a lot of the folks that are most susceptible to getting the virus and dying. The older folks, the folks in the nursing homes are going to start getting this vaccine here within weeks. If we could just show the discipline and hold on to it and help keep those folks safe when the vaccine's right around the corner. Don't do anything personally to spread it among other people, even if you're not having contact with that person that is elderly or has some conditions that make them more susceptible. Perhaps you run into somebody else, infect them, and they run into those people. We're all in this together. We all have to work to keep each other as safe as we possibly can. When we take a look at the numbers that we have, we're in that place where we're concerned. Number of new COVID cases has gone up 75%. Since December 1st. The number of new COVID hospitalizations, that's daily admissions, 7-day moving average has gone up 67% since December 1st. The 7-day moving average of hospital beds occupied, that's the census in the hospital, has gone up 37% since December 1st. The number in our ICUs has gone up 20% since December 1st. This is now, we have to show a little discipline, especially as we go into the Christmas holiday and Christmas next week, and then New Year's Eve the week after that. We're looking at potentially going to the red district risk 5 level. What that would entail, we don't know yet. We're kind of working through those things, but probably really renewing the request of everyone that they not eat inside at restaurants. And even better than eating outside at a restaurant is getting food to go or take out or carry out. And we do that in order to keep each other safe. Now, the corresponding element for that for restaurants is we have to help keep them and their businesses and their employees safe too. So if you're not going to be going to a restaurant, please, to the degree that you can, order out, order some food, go pick it up, over-tip the wait staff. This is a holiday season where a lot of these restaurants are looking at trying to make a significant amount of the income that they generate over the course of a year. So while we recommend restraint with respect to eating inside, and while we consider some of these steps for red risk 5 area, please support your restaurants if you can. Let the restaurant do the cooking for the family. Buy some gift cards that maybe you'll use in the future, or what. Rules about being considered with the red rules. Highly recommend that people don't sit or dine at counters or at bars. Make sure that when you're lining up, if you line up, to make sure you're at least 6 feet and wearing a mask, 6 feet apart from anybody else that you're in line with. Same thing true for retail. If you go to a retail store, best to pick it up curbside, best to shop online. But if you're going to go shop, grocery stores and pharmacies, make sure that when you're in line checking out, that you're maintaining that 6 foot distancing and everybody is masking. We want to try and make this work as best as we can. Again, we're so close to getting the vaccine to everyone. Let's wash our hands, use hand sanitizers, make sure that you're wearing your masks, make sure that you social distance. If we went into that red area, I would imagine that Dr. Escott may recommend to the schools that they don't do the extracurricular activities if they can, because we're seeing a lot of infections coming up that way. We're probably going to be urging people, especially on New Year's Eve, not to be out late. Don't plan on any New Year's Eve midnight parties except with the folks that you live with at home. We're seeing a real surge in infections among folks in the age group that are probably most likely to be in bars or restaurants that are actually bars but fitting under the exception that the governor established. We just have to hold on here a little bit longer, especially during the holidays that are coming up. But again, even if we don't move to that red level 5, Austin Public Health is recommending right now that you minimize gatherings outside of your household. Try to keep those down, not do them at all if you're in a position to be able to do that. But if you do them, make sure you're meeting outside, 6 foot distancing. The grocery stores, we're getting to the place now where probably recommended that only one person should go shopping at a time instead of the whole household, so that the number of people that are in those stores are fewer, which helps minimize the risk for everybody else who's shopping. Please continue washing your hands, wear your mask, social distance when you're not in the house. Yesterday, Travis County Judge Brown and I extended the eviction protections through to February 1st. That gives us a chance to see what the federal government is doing here. It looks like they're going to extend theirs to about the same place. Our justice of the peace courts that handle a lot of evictions, we're working with those judges to make sure we craft a policy that is fair and equitable and just. And I would point out that the data shows that eviction actions like ours really save lives during the pandemic. Evictions have been associated with hundreds of thousands of additional COVID cases in cities that don't have protections. So if you look at how cities are doing with and without eviction protections, Austin has eviction protections almost consistently, a lower number of cases. Austin's doing a really good job. Austin leads big cities in Texas at the lowest pandemic-related evictions, has some of the fewest filings in the nation. We've had 725 eviction filings since March 15th. Fort Worth, by way of example, has had 9,266 compared to our 725. Houston has had 18,299 compared to our 725. And in addition to that, Just by way, parenthetically, the City Council launched a $12.9 million relief of emergency needs for tenant rent program this fall. Just approved an additional $2 million of additional rental assistance where we pay the landlord on behalf of the applying tenant. I want you all to enjoy the weekend. I'll be back on to talk to you. It's a holiday next week. Best to stick to your households as best you can. If you do gather, outside is better. Mask and distance from people that don't live with you. Avoid contact with people in your home. I know it's really hard, but now's not the time to be hugging people. Don't even shake hands. Hang on here just a little bit. We'll talk here about the vaccine and how it's being rolled out. But for right now, stay safe this weekend. Let's continue to watch the numbers. I'll be back in touch to talk with you about them. Take care. Good night.